So coming to the next topic, that is demyelinating disorders of CNS. Part 1 in this case, multiple sclerosis. Now, what is a demyelinating disorder? In a demyelinating disorder of the central nervous system, in the demyelinating disorder of the central nervous system, presenting with multiple episodes affecting different locations of CNS. Okay. Now, what is a demyelinating disorder? In the demyelinating disorder of the central nervous system, it presents with multiple episodes affecting different locations of the CNS. Now, any demyelinating disorder, it presents with multiple episodes and it usually affects different locations of the CNS. Now, sites of demyelination. What are the sites of demyelination? The most commonly affected is the periventricular region in this case. Okay, the most commonly affected site of demyelination is the periventricular region, and the next most commonly affected is the spinal cord. That is, the sensory tract is more commonly affected than the motor tract. Now, in sites of demyelination, the most commonly affected site are the periventricular regions. Okay, and first of all, the most commonly affected site is periventricular region, and the next most affected site is the spinal cord. Okay, in spinal cord, the sensory tracts are more commonly affected than the motor tracts. Okay, now usually the sensory cell bodies lie in the posterior arm. Now, other sites of demyelination, most common periventricular, then the spinal cord. After that, we have the optic nerve, then the cerebellum, optic nerve, then the cerebellum, then the brainstem. Small periventricular region, then the spinal cord, then the optic nerve, then the cerebellum, and then the brainstem. Now, the autoimmune disorder with both cell-mediated immunity and humoral immunity. Okay, now it is usually an autoimmune disorder which has both cell-mediated immunity and humoral immunity. In this case, anti-MBP antibody is the most common. Okay, anti-MBP antibody is the most common. Now, what is the epidemiology of multiple sclerosis? Now, what is the epidemiology of multiple sclerosis? The age is 20 to 40 years. In this case, in case of multiple sclerosis, the age group which is affected is 20 to 40 years, and the gender that is affected is in females more than males with a ratio of 3:1, and geography-wise, increased incidence in countries away from the equator, like North America and Europe. Okay, first of all, the age group that is affected is 20 to 40 years, seen more commonly in females, and the geography-wise, it is an increased incidence in countries away from the equator, like North America and Europe. They are the most affected sites for the multiple sclerosis. Now, this means that multiple sclerosis, the cases are less common in India, but still we'll have to study it because we might be treating some of the foreign patients because India's healthcare system, it is easily available and it is good also. Now, the EBV infection at young age is the most common etiological and risk factor. After that, hypovitaminosis D. First of all, EBV, hypovitaminosis, then the next important cause is adolescent. After that, the obesity. First of all, the etiology and risk factor wise, we have the EBV. The most commonly affected site is the EBV, hypovitaminosis D, then adolescent, then the obesity. We can remember this mnemonic from it is right some more causes. Other not so common causes can also be smoking and genetics, they can be HLA TRP1. Okay, and it is associated with increased risk of multiple sclerosis. So till now we have seen how goes. Okay, we can just remember this not so important topic for the etiology of risk factors. H for hypovitaminous A for adolescents, T for genetics such as HLA-TRP1, obesity, EBV, and smoking. After that, the clinical presentation. In clinical presentation, so what we have studied till now in multiple sclerosis, we have studied what are demyelinating disorders and how its episodes affect different patients. What are the different sites of demyelination? The causes of multiple sclerosis, the etiology and the risk factors. Okay, this is about epidemiology, then etiology and risk factors, and clinical presentation. After that, the clinical presentation. Okay, it depends on the site of demyelination. The clinical presentation, it depends on the site of demyelination. Now, according to the site of demyelination, the most common presentation is sensory, that is long tract symptoms, like the clinical presentation, which depends on the site of demyelination. The most common presentation, what is the most common presentation? It is usually sensory, that is long tract symptoms like clinical presentation. Okay, usually the most common presentation is sensory, such as long tract symptoms are there, and इस केस में क्या होता है कि there is also loss of sensation and a sensation in loss of sensation such as dorsal column sensations. इस केस में जो dorsal column में sensation होती है such as fine touch, vibration and proprioception, वो चली जाती है. Then paresthesias, they can be paresthesias, दर्द हो सकती है जैसे कि pain, loss of sensation, paresthesias, pain. After that, the second most common presentation is optic neuritis, presenting in 25% of patients, which is unilateral and retrobulbar. Usually this involvement is segmental and it affects less than 50% of optic nerve length. The patient presents as monocular painful vision loss. Now what is the fifth one? Patients with demyelination in the brainstem, they present with isolated brainstem syndrome. Their ascending and descending tracts are not affected, only cranial nerve nuclei are affected. Now, since now the most common symptoms in case of sensory long tract symptoms are loss of sensation such as dorsal column sensations, fine touch, vibration, proprioception. First of all, then the second most common presentation is optic neuritis, which presents in only 20% of the patients, which is unilateral, that means it affects only one side, and retropulbar means behind. Involvement is usually segmental. Segment-wise involvement is there in optic neuritis, and it affects less than 50% of the optic nerve length. Then multiple sclerosis, it affects the optic nerve, it affects less than 50% of the optic nerve length, and the patient presents as monocular painful vision loss. Monocular, one-sided, painful vision loss. Okay, obviously there will be pain, paresthesias, or patient with demyelination in the brainstem present with isolated brainstem syndrome, where ascending and descending tracts are not affected. Okay, watching patient with demyelination होती है, patient with demyelination होती है brain ਦੇ ਵਿੱਚ, ਉਹਨਾਂ ਦੇ ਜਿਹੜੇ brainstem ਹੈ ਉਸ ਦੇ ਵਿੱਚ isolated brainstem syndrome ਹੁੰਦਾ ਹੈ, ਉसी brainstem ਵਿੱਚ isolated brainstem syndrome ਹੁੰਦਾ ਹੈ, ਜਿਸ ਵਿੱਚ ascending and descending tracts ਨੇ they are not affected, only the cranial nerve nuclei are affected. Brainstem ਦੇ ਵਿੱਚ ascending and descending tracts ਨੇ usually नहीं affected, the cranial nerve nuclei they are affected. Now after that, the demyelination in the cerebellum can result in cerebellar syndrome. Okay, which means presenting with ataxia. The person is Okay, cerebral syndrome we all know. Okay, in case of multiple sclerosis, cerebellum may also be included along with the brainstem, optic neuritis, pain, paresthesia, and loss of sensation in dorsal column sensations. Okay, there can be ataxia, nystagmus, that is common, and the third one is dysdiadochokinesia, that is also common. Now, last symptom is demyelination affecting the motor pathway. Now, in this case, the patient will present with weakness or spasticity of the affected part. In demyelination affecting motor pathway, the patient will present with weakened spasticity of the affected part. And what are the ancillary symptoms? These are the common symptoms up till now. Okay, ancillary symptoms means additional or secondary systems that support the main diagnosis, okay, but are not the primary or key features of the disease. They can be, it is pretty easy, they can be Lermitter's sign. Lermitter's sign. Now, what is Lermitter's sign? It is important. It is a shock-like sensation on the spine on forceful flexion of the neck. It occurs due to demyelination of the sensory tract. Okay, now what is Lermitter's sign in this? जो एक बंदा ठीक है अपनी नेक बेंड करता है, फोर्सफुल फ्लेक्शन करता है, तो एक शॉक लाइक सेंसेशन होती है ऑन द स्पाइन. It can be due to demyelination of the sensory tract, obviously. The next important sign is Uthoff's phenomena. Now, what is Uthoff's phenomena? It is heat sensitivity. Okay, it is Uthoff's phenomena. It is heat sensitivity of the symptoms of multiple sclerosis. That is, whenever the body temperature increases. That is, whenever the body temperature increases, there will be development of conduction block, worsening, just a second, worsening there's a condition, worsening the symptoms. Okay, now when there is Uthoff's phenomenon, it is a heat sensitivity of the symptoms of multiple sclerosis. Whatever the symptoms we have discussed now, it is a heat sensitivity. Or the heat sensitivity, that is whenever the body temperature increases, there will be development of conduction block, worsening the symptoms. Okay, the symptoms will worsen whenever the molecular body temperature rises there. After that, Pull-Fritsch phenomena. In this, P for Pull-Fritsch, P for phenomena, P for pendulum. Okay, in this case, when a pendulum is demonstrated to a patient in 2 dimensions, the patient starts seeing 3 dimensions. Okay, in Pull-Fritsch phenomena, when a pendulum is demonstrated to a patient in 2 dimensions, the patient starts seeing 3 dimensions. Now, what does that mean? Pull-Fritsch phenomena. Okay, it is a visual illusion. It is a kind of visual illusion in which a person perceives a moving object as following a curved path, even though it is actually moving in a straight line. It occurs when there is a difference in visual signal timing between the 2 eyes. Okay, after that, the last sign is MS hug, multiple sclerosis hug. There is a tight band like sensation, okay, in this case. So that's all for this. Till now we have studied the ancillary symptoms such as Lermitter's sign. From Lermitter's sign, you should remember the term shock. Uthoff's phenomena, it is related to heat sensitivity. Pull-Fritsch phenomena, pendulum. MS hug, tight band like sensation. That's all.